visual diagnosis, inspection, changes in complexion color during a disease. Changes in complexion color during a disease. Observation, when observing complexion color, in addition to the above-mentioned aspect, whether the abnormal color is superficial or deep, distinct or obscure, lustrous or lustreless, scattered or concentrated, conforming or opposing, attention should be paid also to observing any changes in the complexion and the course of chronic disease. In chapter 49 of the spiritual axis says, if the complexion color looks contained and slightly bright, it indicates that the disease is mild. If the complexion color is dark and lusterless, it means that the disease is severe. If the abnormal color moves upward in the face, it is a sign of aggravation of the disease. If the abnormal color moves downwards in the face, like black clouds dissipating, it is a sign of the gradual alleviation of the disease. Clinical significance. The changes occurring in the complexion color in the course of a disease reflect the changes in relative strength of pathogenic factors and upright. Changes in the complexion color indicating a worsening of the condition are as follows. From the conforming to opposing, from thin to thick, from superficial to deep, from distinct to obscure, from scattered to concentrated, and from lustrous to lusterless. All this indicate that the disease is moving from the exterior to the interior. Pathogenic factors are growing stronger. Upright chi is getting weaker. The disease is becoming more severe and the treatment given is not effective. Changes in the complexion color indicating an improvement in the condition are as follows. From opposing to conforming, from thick to thin, from deep to superficial, from obscure to distinct, from concentrated to scattered, and from lusterless to lustrous. All these signs indicate that the disease is moving from the interior to the exterior. Pathogenic factors are subsiding. The upright chi is becoming stronger. The disease is getting better and the treatment received is effective. In Suen, chapter 15, face color changes in course of illness and prognosis. Diseases with superficial complexion should be treated with Tang Yi, Honji made of 5 grains, and can be cured in 10 days. Diseases with deep complexion should be treated with drugs and can be cured in 21 days. Diseases with a very deep complexion should be treated with Lao-Ji, thick wine made from 5 grains, and can be cured in 100 days. Disease with a haggard and bony face will lead to death in 100 days. The changes of complexion on upper, lower, left, and right areas of the face indicate the changes in the course of a disease. The upper is unfavorable and the lower is favorable. In women, the right side is unfavorable and the left is favorable. In men, the left is unfavorable and the right is favorable. Comment. In this passage, superficial complexion and deep complexion are equivalent to the superficial or deep color of the complexion described in this chapter. A color is defined as superficial when it is seen clearly on the surface of the complexion, while it is defined as deep when it appears to be a level below the surface. This chapter clearly says that the superficial color of the complexion indicates a better prognosis than a deep color, as the former can be treated with food therapy, while the latter with the herbal medicinals. The second part of the quote requires an explanation. Firstly, when Suen says the upper is unfavorable, it means a movement of the color from the lower to the upper part. And when it says the lower is favorable, it means a movement of the color from upper to the lower part. Similarly, when the quote says the right is ni, it means a movement of a color from left to right. Likewise, for left is ni, secondly, it should be remembered that men pertain to yang and the left side is yang. Women pertain to yin and the right side is yin. Though in women, a movement of the color from left to right is unfavorable because the right is their side, while a movement of the color from right to left is favorable. Vice versa for men. Part 1, the complexion, color, and emotion. Specific signs in the complexion may indicate various emotions. Anger usually manifests with a greenish thing on the cheek or under the eyes. If there is such a thing in the forehead, it means that the liver chi has invaded the stomach. If on the tip of the nose, that liver chi has invaded the spleen. Being prone to anger may also be manifested by eyebrows that meet in the center. In some cases, if the anger is bottled up inside as resentment, leading to a long-standing depression, the complexion may be pale. This is due to the depressing effect of a stagnant liver chi on the spleen or lung chi. In such cases, the wiry quality of pulse will betray the existence of anger rather than sadness or grief, indicated by the pale complexion as a cause of disease. Excess joy may manifest with a red color on the cheekbone. Worry causes a grayish complexion and skin without luster because it nuts lung chi and affects the corporeal soul, which manifests on the skin. Pensiveness may manifest with a sallow complexion because it depletes the spleen chi. Fear shows with a bright white complexion on the cheeks and forehead. If the chronic fear causes deficiency of kidney yin and the rising of empty heat of the heart, there will be a malar flash with the underlying color being bright white. Shock also causes a bright white complexion. Shock early in the childhood may manifest with a bluish sting on the forehead, such as bluish stings there or around the mouth indicates a prenatal shock, while in the uterus. Hatred often shows with a greenish complexion on the cheeks. Craving shows with a reddish color on the cheeks. Guilt shows with a dark, ruddy complexion. Okay, the emotions and the complexion color. Anger, greenish or cheeks or under eyes. Excess joy, red on cheekbones. Worry, grayish without luster. Pensiveness, shallow, yellow. Fear, bright white on cheeks and forehead. The shock, bright white or bluish. The hatred, dull greenish without luster. And the craving, reddish on cheeks. Ling Shu, Chapter 4, Correspondence of Complexion and Pulse. Bluish complexion is accompanied by a wiry pulse. Reddish complexion is accompanied by a hook pulse. Yellow complexion is accompanied by intermittent pulse. Whitish complexion is accompanied by a pulse like hair. It's soft. A blackish complexion is accompanied by a pulse like stone, hard. Complexion colors. The complexion colors are normal, white, the yellow, red, bluish or greenish, dark, and purple. In a normal complexion color, observation, as normality obviously varies from the race to race, it is impossible to define a universal normal color. We can, however, identify and define four essential characteristics of a normal complexion. Number one, the luster. Two, a subtle, slightly reddish hue. Number three, contained veiled color. Number four, moisture. The presence of luster is an essential part of a normal complexion. Such a complexion is slightly shiny, vibrant in color, lively, relatively bright and glowing. The presence of luster in the complexion indicates that the upright cheek is intact, even though there may be a pathology, and that the mind and spirit are healthy. The luster of complexion is equivalent to the spirit of the pulse, one of the attributes of the normal pulse, or the eyes. They all indicate a good state of mind and spirit. The normal complexion should have a subtle, slightly reddish hue because the facial color as whole reflects the state of the heart, and a reddish hue indicates a good supply of heart blood, and by implication, a good state of mind. The color of the facial complexion should be contained as if there was a very thin white silk veil over it. The book Wang Zhenzun Jing described the normal complexion color as being bright and lustrous and says the complexion is bright because of the embodiment of the spirit. It is lustrous because of the nourishment of the essence and blood. The normal complexion should be moist and look firm because of the fluid underneath. A dry complexion is always a poor prognostic sign. The moisture of the complexion is equivalent to the stomach chi of the pulse, one of the attributes of the normal pulse. They therefore both indicate that the patient's stomach chi is intact, even though there may be pathogenic factors. Apart from these four basic aspects of normal complexion, the actual color, of course, varies enormously according to race and even within the same racial group. The normal complexion color for Caucasian people is mixed white and slightly reddish color, which is lustrous, bright, and contained. Within the Caucasian race, however, there can be considerable variations in normal complexion. For example, the normal complexion of a Norwegian person will be quite different from that of a Spaniard as the Mediterranean complexion. It's naturally slightly darker and of a more earthy color than that of the Northern European. The complexion of Chinese people is described in Chinese books as a mixed red and yellow, color shown slightly which is bright, lustrous, and reserved. The same wide variations may be observed in Asian, African, and African American people. For example, the complexion of people in North India is much lighter than that of Indians from the south. Apart from racial differences, there can be a wide variation in normal complexion in people of the same race due to other factors such as the influence of prenatal constitution, the profession, the area people come from, and their working or living environment. However, complexion color changes caused by the above mentioned factors are not regarded as abnormal. For example, the normal complexion of a farmer will be rosier and redder than that of an office worker. The normal complexion color is like in this picture. The clinical significance, bright Lustrous, white, reddish, and contained complexion color in Caucasian people indicate in strong stomach chi, normal internal organs, ample blood, and good spirit. This is regarded as a normal complexion color. If such a complexion color is observed in the process of disease, it means that the duration of the disease is short. The pathogenic factors are weak. The upright chi is still strong. The treatment will be easy, and the prognosis is good. Chapter 17 of the simple question says, in the course of a disease, if the pulse is small and the complexion color is normal, it is a disease with a short duration. If the pulse is normal but the complexion color is abnormal, it is a disease with a long duration. If both the pulse and the complexion color are abnormal, it is a disease with a long duration. If both the pulse and the complexion color are normal, it is a disease with a short duration. This highlights are this highlights the connection between complexion, color, and the duration of the disease. Attributes of normal complexion. Number one, luster, the spirit strong. Number two, subtle reddish hue, heart blood abundant. Number three, contained, vague color, no pathogenic factors. Number four, the moisture, good state of fluids. Thank you for your attention.